endorsed Bethany a few years ago for Saudi America, an excellent book regarding what fracking has done in terms of making the United States energy independent, an actual net energy exporter, which is kind of hard to believe, and the geopolitical ramifications of it. The Saudis and the Russians weren't too happy about it. But probably the two books most people know you for is yourself and a colleague are basically were the journalists who exposed the fraud and kind of broke the eventual story that led to the collapse of Enron and the smartest guys in the room. That focuses on one company, mostly. Your next big book, All the Devils Are Here, focuses on the 08-09 financial crash, global financial crisis, but largely the role financial markets, especially related to mortgages, played in that crash, kind of one industry. But in this book, you're taking on, a lot of ways, the entire U.S. economy, and a lot of ways just overall U.S. forms of governance. For any of you who are interested in the book, it is related to COVID, but I would say COVID is kind of like the torch that's used to light up a kind of ugly and dark cave that you've walked into, and COVID just let us see the fissures in our governance, our kind of squabbling left and right in terms of politics, financially unprepared for this, economically unprepared for this, hospitals not prepared for this. What do you want people to take away from this book? You took on a lot, and you did an excellent job of it. I learned a lot.
Thank you.
But what do you really want people to take away from it?
So I think you're right. It is sort of an interesting progression in that my first book was about one company. The next book was about all these companies in the global financial crisis. And then this is about this big sprawling thing. So I guess maybe... Oh, you can't hear me? Huh. I'll try to speak up a little. Can anybody hear me?
Zahava, do you want to come closer?
Do you want to come?
Yeah, why don't you come closer?
I do have a very soft voice, but I will try to yell at the risk of overpowering the room. I guess in the best of ways, I've moved from being a chronicler of business gone wrong to just a chronicler of disasters. So maybe that's an expansion of sorts. But I think what Joe, my co-author, my longtime co-author, and I have always tried to do is to step back from the conflagration at hand and say, okay, what happened? Why was it so bad? So in the case of Enron, what was the story that led to its collapse? We didn't just want to tell a TikTok of its collapse. We wanted to say, why? What happened? And in the case of the global financial crisis, instead of chronicling the meltdowns of the biggest banks, we wanted to step back and say, how did the conditions get set such that this could happen? What laid the groundwork for this? And I think that was the question we set out to answer with the pandemic. Why was it that the world's wealthiest country had such terrible outcomes? Why couldn't we do a better job of taking care of our people? Not just the world's wealthiest country, but the one that spends as a percentage of its GDP almost double the amount of any other country on healthcare. What went so wrong? And I think there's, at least in some political circles, there's a very convenient story that it was just a bad president. And if we had just had a president who wasn't Donald Trump, then this all would have been better, and America would have escaped the pandemic unscathed. And I think that's a little bit of magical thinking, because the deaths in the first year of the Biden administration were actually higher. And while the periods aren't directly comparable, this clearly isn't an issue that just a different leader could have fixed the whole thing. So we set out to look at what were the problems, and a lot of that, I think, the answer is our very dysfunctional healthcare system, but also the way in which so many parts of our society have become financialized, where the bottom line is what dictates whether something is good or bad. And we don't often step back and say, wait, how are we getting to that bottom line? Do we like the rules? Do we like the way the game is being set up? Because the reality is the game is always being set up, right? They're even in the freest of markets, there are rules that dictate how the game is being played. And the rules differ in different businesses. And in healthcare, the rules are just particularly screwed up. And then that just led us into polarization and what an increasingly difficult time we have listening to each other. And I think that's rapidly becoming part of the problem.
And we'll get to kind of the pandemic, the outbreak of it, and how it was handled, mistakes by Trump administration and mistakes by Biden administration. But even before we get there, you highlight in the book like you mentioned, even to the most expensive comparable first world nation, we average 2 to 3 times the amount of money spent on healthcare per person. But our relative death rates were much higher than most Europeans, almost 7, 8, 10 times higher than Japanese. We were comparable to, say, Brazil. So a lot of this was endemic and problematic before COVID ever got here. And one of the things you highlight in the book in particular is this American obsession, and it's even in the law, of defining and being a fiduciary agent as a financial institution for companies and shareholder value. But what has that done to our medical system, and especially in terms of private equity and for-profit hospitals and nursing homes?
Yeah, so COVID, as we all know now, preyed on people with pre-existing conditions, and those pre-existing conditions were put in motion or exacerbated by lack of access to health care, and then the very people with pre-existing conditions had the worst access to health care in the pandemic. So when you think about all the stories of overrun hospitals, they were always hospitals in less well-off areas. You didn't hear of the wealthiest hospitals being overrun with patients, the wealthiest hospitals that could offer people the best care. And so, of course, the death rates are going to be much higher at a hospital that is being overrun than one that has plenty of staff on hand to take care of people. And I think there are a bunch of things that have gone wrong. I mean, you could probably write 10 books about our healthcare system and how screwed up it is. But because of our focus as business journalists, what we looked at is this. We have this really odd set of incentives in the hospital sector in particular, where we've sort of societally constructed who makes money by all these rules around what procedures are reimbursed how much, but none of it has anything to do with keeping people well and making sure they don't go to the hospital in the first place. And that's why you had this incredibly terribly ironic thing happen in the pandemic where hospitals had never been busier, yet they were going bankrupt. And if you stop to think about that, isn't that absurd? How can you have an institution that has never been busier, but yet the things that they made their money on, elective surgeries, had come to a halt? So they were going bankrupt, taking care of patients. And then when you step back from that, you know, we tend to look at hospitals and say, good hospital, it makes money, it's profitable. Bad hospital, even supposed not-for-profits have fallen into this trap. And yet we've decided by government reimbursement rates who's going to make money and who isn't going to make money. And then people will come in and say we have too many hospital beds, and they close the hospitals that aren't making money without looking at the fact that we already decided in advance who was going to make money and who wasn't going to make money. And without stepping back and saying, wait, if healthcare is part of our country's critical infrastructure and people need to have access to health care, then does it make sense to be closing hospitals and leaving hospital deserts in swaths of the country because we've societally constructed the fact that these hospitals can't make money? And so I think that's one piece of it. We also chronicle in the book a lot of the ways in which private equity, which for those of you who aren't finance people, they were known as LBO firms, in that when private equity first came into business in the 1980s, and they basically buy out companies using a lot of debt. And the original model of private equity maybe had some validity to it, because the idea was you bought a company and you made it better, you made it run better out of the eye of the public market, and then you sold it back to the public market and you made your money. It was capitalism in its purest form in a way, but at least it kind of made sense. And private equity firm made money if the company was successful and did better. But in this modern era where private equity firms can buy companies and just load them up with debt, because in an era of ever declining interest rates, debt is really cheap. It is really, study after study has shown that private equity firms don't add a lot of value. They're just basically adding debt to companies and getting their money out. And they came up with another tool in the hospital sector, which was to sell the hospital's underlying real estate. So that was another way to make billions of dollars. And so you have this really odd escapade, basically, or romp through the U.S. hospital sector, where in 2011, 7 of the 11 biggest hospital chains were owned by private equity firms. And now they're almost all gone, and you wouldn't even know, really, private equity has a pretty minimal presence left in the hospital sector. But what is left is a lot of debt. And they didn't make hospitals better. They didn't take poor performing hospitals and turn them around and make them efficient paragons of virtue that offered good health care to Americans. They just left behind these really heavily indebted institutions. And while that's a broader story than the pandemic, I think it plays directly into what happened in the pandemic. A study came out right after our book went to press that said the major determinants of death rates in various counties in the U.S. wasn't lockdowns or no lockdowns or masks or no masks. It was access to health care and people's trust in the system that seemed to shape that seemed to dictate what the death rates were. And so in places without access to health care, where people had lost their faith in the system, you had much higher death rates.
And as you cover in the book, and you touched upon, what's kind of shocking is during the greatest crisis we've had since the 1918 flu, hospitals, even once they got billions of dollars, depending on the scale or the size of the corporation, of assistance from the government, they were still laying off workers. They're still either furloughing or laying off nurses, essential staff. So they're understaffed. And then that's for the for-profit hospitals, usually in the nice parts of town, the people who have insurance. But for the people who really are dire and desperate, we call them safety hospitals, or especially rural hospitals, those in the poor parts of town, for people with Medicaid or no or poor insurance. It's a much more dire situation. The death rates are sometimes very often higher. You highlight in the book, just for us here in Texas, rural counties in the South had a death rate twice the national average. And some of that's because of the very poor lack of access to medical care in rural counties. So rural populations more broadly, and then specifically African American and Latino populations had much higher death rates. Can you explain why that was all the situation?
So I think it's the same answer. It's lack of access to health care before the pandemic, that our lack of focus as a country on keeping people healthy. A guy who ran a hospital told me this story. He said basically, if you have terrible diabetes and you need to have your leg chopped off as a result of it, the hospital will happily chop off your leg and make the money from chopping off your leg. But in terms of treating your diabetes beforehand, so you don't need to have your leg chopped off, no. That we don't do. And so we've built this system where you get paid for chopping off the leg, but you don't get paid for basically making sure the leg doesn't have to be chopped off in the first place. And then a pandemic comes along that preys upon people with pre-existing conditions, and so it was baked in some ways. And then you had another issue that took place too that I think the answer to it is very complicated, but there are these rules that are supposed to govern transfers. So if one hospital is full and another hospital is empty, the full hospital is supposed to be able to transfer their patients to the beds in the empty hospital. And during COVID, that didn't really happen. And it didn't happen in part because we don't have a system. We have this patchwork set of entities, and so nobody was in charge of saying they're beds here and they're not beds here, and let's transfer patients from here to here. But it also didn't happen because hospitals don't want patients with Medicaid and no insurance who are going to have to move in for a month. And so they can find ways to say, you only think we have beds available. We don't really have beds available. We tell the story of a safety net hospital in Los Angeles where the CEO knew there were beds available at other hospitals and would call them herself and then be like, you must be mistaken. We don't actually have a bed available. And so that happened a lot in rural areas too. There wasn't a place to send people, and some of the equipment that was needed to treat advanced cases of COVID, poor hospitals just didn't have any of it, and so that was part of the problem.
And then, kind of looking at once the outbreak is here, we all remember scrambling to find masks. I'm like the black sheep of my family. I'm about the only O'Malley who's not a doctor. My brother's a doctor up near Seattle, and I remember trying to find masks here in Houston and mailing them to him, which is just crazy. But that's the way the whole country was. That's the way the whole world was. You discuss the madness between PPEs, personal protective equipment, masks, gowns, all the essential items, especially for the hospitals they need. And here again, people were thinking, well, the person who's going to save the day is the private sector and basically just a free market. You describe a meeting of some high-level CEOs from across the board in the United States getting together, meeting with Jared Kushner in the White House and saying, we need to figure out how to work on this together because right now states are competing with each other to buy masks. Hospitals across the country are competing with each other to buy masks. So the only thing that's happening is the prices are going like this and the quantities that are available are going down. We need to work together. And you mentioned the book. He said, this is not something the government be involved in. The free markets will solve this. I'm not trying to pick on Kushner, but it's just a broader idea that free markets can solve everything.
Yeah, so I think that story has two aspects to it, and one is the way in which we slowly outsourced a lot of our manufacturing in this country. The PPE is well understood that it had all been outsourced to China, ironically enough, and of course we discovered as the pandemic wore on that we'd also outsourced most of our semiconductor manufacturing, and we're now figuring out what we're going to do about that. But I think it was all once again in the name of this bottom line efficiency. That more profits, a bigger bottom line was seen as good without there being a recognition that maybe there's a trade-off between a bigger bottom line and resiliency. And if you squeeze everything out of the system in the name of eking more profits out of it, maybe you don't have resiliency when a crisis hits. And so that's what happened to us. We discovered that a global just-in-time supply chain is really not resilient at all in a crisis. And so there are all these stories of hospital procurement people trying desperately to get PPE in this black market that sprung up where you'd get a box of PPE only to find out that the masks were ripped and the gowns were soiled, and it became this complete free-for-all. And I think the broader subtext for me is this idea that not everything can work according to the dictates of a free market, and you have to make sure before you turn it over to the quote free market what it is you mean by that in any given situation, because a free market doesn't just magically happen in any market. Even the freest of markets has rules. Like think about maybe some of you in your room are your most free marketeer friends. Well, they rely on the existence of a limited liability corporation. They rely on bankruptcy court. What are those but rules that dictate, that lay the groundwork for how the market is going to function? And so you can't just cite the free market without stepping back and saying, what ground rules are we putting in place? There are always ground rules. And in the case of PPE, when you've outsourced all of your manufacturing, and then you set up this competition between states and hospitals to get whatever they can, and it's a free for all. Maybe that's a time where a government that could lead would exert some leadership.
And you highlight three kind of fascinating figures, all kind of showing some darker shades to them in the book. In terms of the government's response, Democrats and Republicans, all three of them presumably were all considering running for president in this upcoming election. But Governor Newsom in California, I won't discuss him, but you guys might remember he went to that famous French Laundry, very expensive restaurant, and that's the elite, do as I say, don't do as I do. But to look at both a Democratic figure and a Republican figure, both Cuomo in New York and DeSantis in Florida, both in many ways were either hypocritical or, in Cuomo's scenario, outright lying and just deviously withholding information from the public. But you talk about how their roles in initially handling COVID actually propelled them to the national stage, but for both of them to a degree also maybe helped unravel their own possibilities for presidential elections.
I think that's probably true. I don't know if you guys remember, but in the early stages of the pandemic, Cuomo was a hero. I think Vanity Fair put him on the cover. People called themselves Cuomosexuals because they thought he was the hero for how you should handle the pandemic. And people who knew were always sort of shaking their heads and saying, "But this guy is actually quite a bit like Donald Trump, and you don't like Donald Trump. Why do you love Andrew Cuomo?" He said at one point, "I don't trust the scientists. I don't I don't believe in the scientists. And then it turned out that, and look, I actually do give people a pass in how they handled the early stages of the pandemic. I think that we as a country were really lucky to have had many pandemics bypass us in the past, and so I think there was a real naivete here, and it took a really long time to realize that this was going to come home to roost. And it's so easy in retrospect to say our leaders should have known that this one was going to be the big one. I think that's one of those hindsight calls that's very easy to make. But nonetheless, Cuomo issued this famous order that sent sick people in hospitals back into their nursing homes. And so that led to the spread of COVID in nursing homes in New York. And then he lied about the number of people who had died in nursing homes. And the early numbers in New York and New Jersey, where the death rates were so terrible, it was mainly people in nursing homes. Some 40% of the people who died in New Jersey were in nursing homes. So our inability to protect our elderly, when we knew very early on who was lucky, who was most likely to get really sick from this, and we knew it was the elderly, and we failed to protect them, and we protected the people who didn't need to be protected as much, namely the wealthy who could lock down and work from home via Zoom and keep our jobs, and have Amazon workers deliver our goods to us, and have DoorDash workers deliver our food to us. And so even our strategy of lockdowns had the effect of protecting those who least needed to be protected, which were the relatively healthy and well off, versus those who most needed our I get worked up when I'm talking about this, those who most needed our protection. And so I think when you look at Cuomo's overall handling of the pandemic in New York, it was a lot of ideology that led people to celebrate him so much. He seemed to be the anti-Trump, so he got celebrated by the mainstream media. And when you look underneath that and say, how good a job did he do? Well, he did an awful job. This might be controversial, but I actually think in the early stages of the pandemic that Governor DeSantis did a very good job. He looked at the data. He said, who's dying from this? It's the elderly in nursing homes. Let's protect the elderly in nursing homes, and let's get the rest of society opened up as quickly as we can, because these are not the people who are at risk from COVID. And he looked at the data himself and made that call, and in the end adjusted for age. Florida's death rate is comparable to California's. And Florida schools were open for the most part. California public schools were not, at enormous cost to the least privileged members of our society, which are underprivileged children. So I actually give DeSantis a lot of credit for handling the pandemic well in the early stages. I think he too began to play to his audience as time went on, and despite his initial support for the vaccine, has become a pretty rabid anti-vaxxer. And I don't think that that's intellectually honest. I think that's attempting to pander to a base that somehow, despite the fact that these were initially known as the Trump vaccines, that somehow it became a mark of your politics whether you took the vaccine or didn't take the vaccine. And really, can you guys think of anything more absurd, that your politics should dictate whether you take a vaccine or don't take a vaccine? Yeah. That your politics should dictate whether you think lockdowns were the right strategy or not? That your politics should dictate whether or not you wore a mask? What on earth does one thing have to do with the other? We carved out these insane ideological chasms where never the twain shall meet, and it became a marker of who you were, your fundamental stance as a human being, and your politics, things that should have nothing to do with politics. We don't think that how you choose to treat cancer is a mark of your politics. We don't think that because you don't think a certain cancer treatment works means that you're a Republican or a Democrat. It's one thing has nothing to do with the other. And I find the way in which we've gone down that rabbit hole to be incredibly discouraging.
And maybe you can touch upon it more, but obviously long before COVID, there were strains of anti-vaccine groups in both the left and both the right. Many of these very wealthy communities, outside of San Francisco, higher rates of, or I should say lower rates of vaccination than most parts of the United States. Obviously, there are people pushing back from the right as well. But it got politicized, and like you point out in the book, initially really by Democrats. You mentioned Kamala Harris during the election year said, in essence, I would trust or listen to the CDC, but I won't believe anything Donald Trump says regarding, like, say, if we get a vaccine. And then from Trump's perspective, probably one of the things that created more distrust from his base was he had an interview, you mentioned Geraldo Rivera, a few weeks before, maybe in September, and said, we think we'll have a vaccine ready, maybe ready by the election, which a lot of people makes you think, wait a second, is this going to be ready because it's ready, or it's ready because it's good for the election?
Yeah.
So this lack of trust was really, fire was thrown on it from both the left and both the right to be suspicious of the government, suspicious of the vaccine. But maybe you talk a bit more about it and maybe how it kind of led to this, sad cycle of, like you saying, that somehow your vaccination status becoming a political symbol.
Yeah, and so I'm an equal opportunity critic, just to be clear about my politics. A friend who read the book said, or actually a guy I didn't know well said to a friend, I can't tell what her politics are, and I was like, thank you. I think I'm going to take that as a really great compliment. But I think there were mistakes made on both sides when the vaccines first, when the Operation Warp Speed first started, these were viewed as the Trump vaccines, and people even referred to them as the Trump vaccines. And the idea was, we don't trust them because they're being developed by the Trump administration. That actually wasn't true, and I'll talk about Warp Speed a little bit when I'm done with this. But then, as soon as Biden was elected, they became something that the right wouldn't touch, because then Biden was pushing them, and then it was, well, then you can't have a vaccine because Biden is pushing them, so you don't get vaccinated if you're on the right. And so it all played into this latent vaccine or not so latent vaccine skepticism in the U.S., where we have this just really big strain of people who are really who have been skeptical of vaccines for a long time, for reasons good and bad, because of the false research that vaccines lead to autism, because of very real ways in which people of color have been treated terribly by the medical community, and therefore have a lot of distrust of what the medical community is saying. But I think, regardless of what led to what happened before the vaccines were released, I also think public health our public health establishment did not do a good job once the vaccines were produced. And what I mean by that is that they oversold the vaccines. The original clinical trial showed that the vaccines were great at preventing severe outcomes or death. They said nothing about whether or not they would blunt transmission, and they did not say that if you take the vaccine you won't get COVID. In fact, some people in the trial did get COVID. The trials explicitly didn't say that. And if our public health community had said, look, these vaccines are a near miracle, they mean that you probably won't die from COVID and you probably won't be hospitalized, but yet you may still get it. And we're not sure yet about transmission. We don't really know what's going to happen. We hope it's going to blunt transmission, but we don't know. Then when you had those outbreaks in Provincetown, I don't know if you guys remember, in the spring of 2021, there was all these headlines, oh my God, people got COVID even after they'd been vaccinated. And the reality was, it was actually a pretty good outcome. The people who got COVID didn't have to go to the hospital, the vaccines worked. But it became another mark of vaccine skepticism, because suddenly the vaccines didn't do what the government had said they did. Instead of preventing transmission in any cases of COVID, it turned out you could still get COVID when you were vaccinated, and you could still transmit, even if you were vaccinated. And if the government had just told the truth throughout the early stages, then when the quote bad thing happened, it wouldn't have been a bad thing. It would have been like, yeah, okay, the vaccine still did their job. And I think this is a lesson for our world going forward. I think people in charge are used to lying in an effort, telling sort of a big lie with the idea that gets people to behave and to cooperate and do what you want people to do. And the problem is that in a world awash in information, people know you're not telling the truth. And so that strategy of not offering nuance and not telling the truth becomes a really dangerous one when people find out that you weren't telling the truth. And instead of then working in your favor, it serves to discredit everything that you've said before. And I think that's something that we're all just beginning to grapple with. What is the right way to deliver a message in a world where everybody has access to information? And if you don't tell the truth, you're going to be found out. But before we move on, I did want to go back to Warp Speed, because I actually think that Warp Speed is a really inspirational story in all of this, on all the things that we're talking about, because it wasn't political. It was actually people people who were not Trump administration supporters, but who took on this task because they viewed it as the right thing for the country. And they did it at enormous cost to themselves. Moncef Slaoui, who ran it, gave up all of his stock in Moderna, would have made him a billionaire before he took on this role. Not a Trump supporter. He did it because it was the right thing for the country. And the scientists did it with the support of the Department of Defense, because this was really an industrial mobilization story. It was about, yes, being able to produce a vaccine that would work, but then it was about being able to manufacture the vaccines at scale. And there was an enormous amount that went into that, and the scientists worked really closely with the Department of Defense, and it really was the public sector bringing what it could bring to this, and the private sector bringing what it could bring, and each one understanding the other's weaknesses and limitations. And so I think regardless of what happened after the vaccines were produced, I think the story of Operation Warp Speed is a remarkable success story. So it's one of my favorite stories in the book.
Yeah, and it's something as a country we should be proud of. And I would think if you spoke to President Trump, it would be one of the things he's most proud of for his years in office. But were you surprised, or the people you've interviewed, a lot of key people in the government who worked with him, and in the general medical community in the U.S., that maybe unlike other leaders around the world, that we developed this first, or at least we developed the most effective one. There were other versions. Chinese had a version, the Russians had a version, Sputnik or whatever. Now people didn't want to take. But that he maybe didn't get his vaccine on camera in a photo op to show, especially to his base, that this is okay, this is safe, this is trustworthy. Well, and then, I mean, was it just a political decision? Because he was proud of the vaccines and promoted it, and then sadly later, you mentioned, eventually got to rallies in like, for instance, Alabama, where he encouraged people to get vaccines and he got booed. Well, how do you think that transition happened?
Well, he was less proud of them after they didn't get approved before the election. And whether they didn't get approved before the election because it simply wasn't possible, or because the people in charge pushed back after Trump began to imply that they would be approved before the election, and that would have cratered people's trust in them and led them to believe that maybe these were a political ploy. So Trump was less eager to embrace warp speed after the vaccines were not approved until after the election. But he tried at first to tell his base to get vaccinated, and by then the Biden administration had started pushing the vaccine, so people were starting to say, we don't want this vaccine. It's part of this overreach by the government. And even Trump got booed at a rally where he talked up the vaccine, and he never did again. That was it. He became as anti-vax as anybody. So it's so disheartening, because the way in which politicians try to play to a base instead of doing what is intellectually honest and what is right for the country. Because I think Trump as a leader could have prevented a lot of the anti-vax sentiment out there and gotten people who did need to get vaccinated to be vaccinated just by being a leader instead of by being a politician.
And, again, not trying to, we'll end on something positive, but again, like I said, COVID didn't create most of these issues. It just highlighted them and kind of made a stark reality of if this is where we are in the United States. One of them being the kind of ever-increasing degrees of inequality, and the kind of especially concentration of wealth in a increasingly smaller percent of the country. We all probably remember the massive bailouts from the federal government, and that was fiscal policy, which is probably most effective, more so than the Fed's policy of adjusting interest rates, we can talk about later. But that largely did help stabilize the economy. Again, the Trump administration should take credit for a lot of that, and the Democrats in Congress who passed those bills as well. But we're talking about literally tens of billions, then hundreds of billions of dollars being pumped into the economy, in some ways like a fire hose and hard to control where it's going. But what we do know is, you mentioned the book, the top 500 companies in the U.S. got large amounts of money, one way or the other, from from the government. But 393 of them, even though they had this cushion, and some of them making big profits, 393 of them either fired or laid off workers, and then 393, I suppose, bought back stock or paid dividends with the extra cash. but that over 50% of them fired or laid off workers. Can you explain that kind of, it seems just insane to think we're all struggling, the whole country's struggling, and here's hundreds of billions of dollars, but we're going to fire or lay off workers or furlough workers.
And so we have this anecdote in the book. Do you guys remember Madonna in her bathtub in the early stages of the pandemic saying the beautiful thing about this pandemic is that we're all in it together? I mean, that could not have been less true. And so, I mean, companies got, especially corporate America, got a really big bailout courtesy of the Federal Reserve because the Fed stepped in and basically did everything it could to keep the economy going, including cutting interest rates to rock bottom levels. But that had the effect of saying to every speculator in the market, come speculate. So any company, even those on the verge of bankruptcy, could sell debt. And it propped up a lot of companies that probably should have gone bankrupt. And it's going to be interesting to see in an era of rising interest rates what happens with our debt-ridden corporate sector and how those companies function going forward. But there wasn't a sense of shared responsibility about that. There wasn't a sense of, oh, we just kind of got a bailout courtesy of the government, so what do we do to give back to society? It was more of the same pretty rabid bottom line focus that we've seen leading up to that, and which made a mockery of companies saying we're in this together and we're going to take care of our workers, particularly our frontline workers. It's just not the way. It's not the way American capitalism works anymore, even in a pandemic. I think the Fed's role is. A lot of people are very positive on the Fed for stepping in and bailing out the system. What I think is worrisome is that the Fed's bailouts keep getting bigger. So the Fed had to step in when long-term capital management, does anybody here remember that? Almost went bankrupt in 1998. And then the Fed had to step in an even bigger way in the global financial crisis. And then the Fed had to step in a huge way in the pandemic. And each time the bailouts get bigger and bigger and the Fed pushes the limits of its authority more and more and rescues parts of the system that are supposed to be outside the purview of the Fed at an enormous cost. And so the question becomes, I think the question is twofold after this. One is, what happens if the Fed can't come to the rescue the next time? Because we've all gotten really used to the Fed being able to come to the rescue with a bigger and bigger bailout every time there's a problem. And why do we have such a financial system that needs to be rescued in a bigger and bigger way all the time? And then I think the second question that we're just beginning to grapple with is, sure, sounds great in an era of free money to do this massive fiscal stimulus, but what does that mean for America's ability to pay its debts when interest rates are higher? And it turns out we were a little bit, see how everything comes full circle, we were a little bit like a subprime borrower, because when we could have refinanced our debt and locked in really low interest rate debt, we didn't. And so now we're going to be forced to pay higher interest rates on our debt going forward, and it's not really clear how sustainable that is. It's going to chew up a bigger and bigger portion of our budget. So this idea that it was free, we had this movement for a little while that it was free to just give out trillions of dollars and that there was never going to be a cost to it because interest rates were low, money was free. Well, it's free until it's not, right? And so I think there is a cost to the way we've lived for the last couple of decades of this reliance on the Federal Reserve and this idea that money was free. We all started to believe it, or I guess too many people in the corridors of power started to believe it.
And just the last question, and then I'm going to get to the audience questions. Great to have students here. Again, great to have the Audi School and some other universities here as well. Like you said, there's a lot of leeway that should be given for what we did not know. We didn't know, first of all, how transmissible this virus was, especially we didn't know initially that it almost exclusively is exponentially more dangerous to older Americans than, say, even middle-aged Americans, and people under 18, extremely rare for it to be fatal. But over time, once we started learning that, we, especially in certain states, we weren't taking that to heed, and probably one of the biggest, longest legacies of COVID is going to be kids who were in shutdown mode and out of school and supposedly trying to learn via Zoom or a computer, if their family even had a working computer and internet. Can you talk about, and it's going to take a while to know it for real, but the impacts of school closures, and maybe why, especially once we knew the risks to young children was not there, even teenagers were not there, why it was continued in so many places?
Yeah, I think it's pretty unforgivable, and it doesn't mean that there weren't understandable reasons for it. And I think it was understandable to shut schools initially because if COVID had been like influenza, which does spread in schools, that's where the super spreading happens, then you would want to shut that down. But COVID was not like that. And I actually think it was clear pretty early on. I remember looking at the data out of Italy and saying, okay, I'm fine, my kids are fine. Doesn't mean I won't get sick from this, doesn't mean we don't have to do our job to try to protect other people, but I'm not going to be self-indulgent about this because we're fine. And that was, we knew the numbers right away. And I remember saying to somebody that if schools couldn't reopen in the spring of 2020, they weren't reopening in 2021 either. And this person said to me, no, that's not going to happen. I was like, yes, it is. And I think I saw it coming for a couple of reasons. One was that, again, in our polarized society, once Donald Trump said we need to reopen schools, every good progressive said we're not reopening schools. That's a terrible thing to do. That's a terrible idea. And it was directly just to repudiate Trump. It didn't matter that on this particular issue he was right. We needed to get schools reopened. And when you look around the world, we're the only country that kept our schools shut. It's not as if we're an outlier. And I think we are going to look back, and it might be a turning point in our country because the numbers are devastating, especially in big urban school districts like Chicago, where I live, like New York Public Schools, like LA United. 30 to 40% of kids were gone. And while there's some signs that the kids who have come back are maybe starting to catch up now, a lot of them haven't come back. And the mental health issues and the lives that have been wrecked by this, it's utterly devastating, and I don't think it had to happen. And I'm not minimizing teachers' concerns about having to stand in front of a classroom, but I think if public health officials had been honest about the spread, the transmission in schools, and that the numbers were very, very low, I don't think teachers would have had to be quite as terrified as they were. I think there were ways we could have mitigated that, getting teachers high quality N95 masks, getting classrooms, having a plastic barrier set up to separate the teacher from the classroom. There were lots of things we could have done to get children back in school. And I know this is a little bit incendiary, but I firmly believe that one reason it didn't happen is that wealthy people's children were in school because private schools opened. Gavin Newsom in California, his kids were in school. I pulled my kids out of school and had them homeschooled. I could do that. My children weren't bearing the brunt of this. If we had really all been in it together and everybody's children had been at home, I bet schools would have been reopened a lot faster than they were. But I think it made a mockery of what we say we care about. We say we care about the least privileged members of society. We say we care about giving children a chance. And when push came to shove, we deprived those children of a chance instead. And I think it's a huge black mark on us. I think it's one that's going to have terrible repercussions for decades to come.
You touched upon some of the questions here. You've touched upon already a lot of it, but just to maybe elaborate upon them. There's not a name on this one, but somebody asked a good question. Why are hospital CEOs paid millions and staff are underpaid? We talked about shareholder value being a priority, but maybe you talk more about this because you discussed it in the book. It probably surprises people. Don't most hospitals, didn't they used to be nonprofits, say affiliated with religion? And where that line you kind of discussed has kind of blurred between even what's a for-profit and nonprofit hospital. What's the reality there?
So people who study hospitals joke that a not-for-profit is just a for-profit in disguise, that there really is no difference between not-for-profit and for-profit hospitals today. The big wealthy hospitals treat people with commercial insurance and offer an incredible array of services and beautiful waiting rooms and expensive restaurants, and they're all competing for the same patients with money and competing ferociously for the same patients with money, while the safety net hospitals are struggling with overcrowded ERs and people packed in like sardines. even before COVID hit. And I think it's just part and parcel of what's happened in our society. It isn't even so much. It's too easy to say it's just shareholder value. It's just this idea that everything that is good or bad is determined by if it makes money or if it doesn't make money. And it's become a very simple shorthand for good and bad, for what works and what doesn't work. And we rarely stop to ask the question, are there parts of our society, are there swaths of our society that should exist outside of capitalism where we don't want that to be the metric? And even if there are things that we want the supposed market to dictate the outcomes, are we looking at how the market Whoa, that was dramatic.
Yes.
Are we looking at how the market is actually functioning and whether the rules that we're setting up are actually helping to drive the outcome that we want, or are they not? And the ways in which we have this whole managerial class of CEOs, and the gap between what CEOs are paid and what ordinary workers are paid just grows and grows all the time. And it's unfortunately race to the top, a race to the bottom in a toppy kind of way. But hospitals would say, then we can't get the best talent if we don't pay these people like a corporation would pay them. So of course we have to pay them like that. But then of course it just becomes this averaging up, because then everybody looks around and says, oh, but if you're at the top of this, you make this, and the more they get paid, then the more they should get paid, right? It becomes this self-reinforcing spiral upwards, where nobody wants to be the one who says, nobody wants to be the hospital or the company that says, oh no, we pay our leader in the bottom quartile, because then it means you pay your leader in the bottom quartile. Well, what does that mean about you? And so we've just created this ratchet that can basically only go one way.
And related to that, Chosova asks, do you think the U.S. should change to a system similar to, say, would you have in Europe or in Canada? And if yes, do you think the U.S. would have done a better job fighting COVID if we had a system where healthcare is free, or say more accessible? Say there's some version of universal healthcare. You could still have private insurance, but just would that help, or would that change much?
I don't know the answer to that, to be honest. I grew up in a mining town in northern Minnesota, and my dad was the only ophthalmologist there. And people from Canada used to come across the border to get their cataract surgery done, because they couldn't. The waiting list for cataract surgery in Canada was 2 or 3 years. So they'd come to see my dad in our little northern Minnesota mining town, because there you could get your cataract surgery done. I do have an appreciation for what the market brings, and I think we in this country are also pretty entitled. I mean, if you tell people are told in a national healthcare system, well, you have to lose 50 pounds before you get your heart surgery. I mean, it's going to be tough. I don't know that we're used to that. On the flip side, and this is not a particularly sophisticated answer, because there are people who know so much more about this than I do. On the flip side, I think the morality that used to keep the private sector in check is increasingly gone. And I keep saying capitalists need to fix capitalism. And you didn't used to have certain things happen. So it's going to sound like a little bit of a tangent, except it really isn't. Do you guys remember Martin Shkreli, who boosted the price on this drug like 5,000% and tried to make money that way? All the big drug companies do that. And there were other drug companies that then tried that strategy too. And all the big drug companies constantly boost the prices of their drugs. That's a way in which they make money. But no one would boost it by more than a certain amount for a long time, because you just wouldn't do that. You just wouldn't do that. And somehow in the last decade, that morality went away. And it became, well, that's what you do. It's a way to get more money out of the system. And so I worry that we're no longer capable of a society of living with a free market, because a free market demands morality, and I don't know that we have any, and that worries me.
And Angie, you talked about this before. Angie asks, can you explain how the wealthy further enriched themselves during COVID? In the book, I mean, you have some shocking statistics in there, but the few hundred billionaires in the United States, wealth during COVID increased by $2 trillion. Right. To give people an idea, that's the GDP, the yearly basic production of a country like Italy or Brazil or Canada. Can you talk more about, I suppose, how this just further deepened the extremes in our economy, especially in terms of excessively focused wealth?
Well, it's all a result in some ways. I mean, there are other underlying factors, but a Federal Reserve policy. So falling interest rates boost asset prices, and the rich in our country own assets. They own most of the stock market and own most of the housing stock. And so when interest rates rise, asset prices go up, and so it becomes de facto that then those who own the assets are going to make a lot of money from this policy. And the funny thing is, the Fed doesn't want that to be the case. The Fed is deeply concerned about inequality and deeply concerned about the idea that its policies could be enhancing income inequality, but it only has this one tool, which is monetary policy. And so when the Fed has been left alone to fix the economy as they were after the financial crisis, that was the tool the Fed had. And so we had this dramatic widening of inequality in the years after the financial crisis, even before the pandemic hit. And it wasn't because that's what the Fed was explicitly setting out to do. It's never what anybody is setting out to do. It just seems to be what happens. And so then in the pandemic, where you had absolutely soaring asset prices across basically any asset class you could mention, that benefited the well-off who own assets. And the unfortunate part about that is that then when inflation set in, inflation takes the biggest bite out of those at the bottom of the socioeconomic ladder, because inflation takes a bigger bite out of people whose budget is more of whom's budget goes to things like food and gas. And so you end up with this really screwed up system. It's not anybody's intention. Nobody's trying to do that, but it seems to be the byproduct of all of our policies nonetheless.
And maybe just before the kind of last question, like you're saying, you're not saying the Fed set out to do this. The flip side is, sadly, another reflection of our dysfunctional partisan bickering. The left and the right can't get anything done. Democrats, Republicans in Congress. A lot of these issues should be fixed by fiscal policy, should be fixed by adjusting tax rates or forms of unemployment insurance, or even healthcare reductions and subsidies. But since Congress hasn't been able to do much of anything the last many, many years, the Fed feels like they are the only ones who can do something. Is that a fair assessment?
I think it was before the pandemic. An economist I really like named Mohammed El-Arian published a book called The Only Game in Town about the Fed. And because it was clear inside the Fed, when you read the minutes, they felt they were the only ones to fix this economic crisis we were in after the financial crisis, because Congress was completely deadlocked. So the Fed felt, well, we're the ones. So you have this entity that sits outside the government and is unaccountable and unelected and has the narrowest set of tools of anybody, just sort of operating as it sees fit. And I don't think that's particularly healthy. We obviously did use fiscal policy in the pandemic, but then it seems to have become a race for who could throw more trillions at without a lot of real thought about how those trillions were being spent and what the ultimate cost of those trillions combined with the Fed's monetary policy might be. Everyone said, well, we haven't had inflation in decades, so inflation is dead. I mean, that worked. So people wanted to believe that the past was prologue and that money was free, and it wasn't.
Great, a great question from Doug. Again, be as optimistic as you can, but realistic as you need be. When the next pandemic occurs, can we expect better results? And maybe, sadly, we were probably lucky with the relatively low mortality rates of COVID. If this had been SARS or MERS, it wouldn't have been as transmissible. It could have been catastrophic. The idea, the military says we're designed to fight the last war.
Yeah.
Are we designed to fight the last pandemic? Or have we learned anything?
I don't know. I used to be really optimistic about the fact that a crisis would teach us something. I remember in the wake of Enron, the thing that came out of that was everyone said, corporate America has gotten really short term. Everybody's fixated on the next quarter. If we just had a longer term view, we would solve a lot of our problems. And I ran around saying that for a while. And 20 years later, we all still say the same thing. If we were only more long term. I'm becoming a little more, unfortunately, skeptical of our ability to face a crisis unless unless there's absolutely nothing else we can do. And part of the problem is that we tend to believe that past is prologue. And so if there is another pandemic, it probably won't look like COVID. It will have a different picture. And it is part of why we raced to shut down schools, as I said, when COVID first hit, because if this were influenza, then schools would have been super spreader zones. But this wasn't. And so the idea that we could just pull out an influenza playbook and use that to fight COVID, well, no, this was something else entirely. We needed to help people in nursing homes. That was where the problem was. I've often thought that maybe the society we live in now is sort of like Charles Dickens' Bleak House, except the orphanages now are the nursing homes. We treat our elderly the way we used to treat orphans in Dickens' time, and that came home to roost in COVID. I'd like to believe we can do better in the next pandemic, but the key thing for how a society does in a pandemic is trust. It's the level of trust that people have in leaders, and we are at an all-time low in trust, in part because of how our leaders behaved in the pandemic. And it's, as you all know, it's way easier to lose trust than it is to regain it. So that worries me.
And sadly, you point out in the book, epidemiologists and experts around the world will tell you, regardless of the specific policy choices, the countries with the highest rates of success, like Sweden, for instance, that had a much less of a lockdown, say, than other countries, correlates almost directly with the degree of trust that people have in their government.
Yeah.
And I mean, that's,
yeah.
Sadly, we're long. I'm trying to think of how we can end positively. What I will say is positively, this excellent book. Positively, I will say Bethany is kindly going to sign them afterwards. And maybe positively, I would say, for any of you might be Democratic, lean left. There are things that will make you think in here. Any of you Republicans lean right. They make things think they're in here. To me, I think a sign of an excellent journalist, and you're one of the best business journalists in the country. I really like your work and encourage you all to read it. Is you're probably going to offend everybody with some parts of this book, which means you're doing your job. But will you all please join me in thanking Bethany McLean? Thank you.